So, a management of oral oncology meds. Oral meds are always going to be harder for us to manage compliance with because we have to convince our patients to take their drugs every single day. If you've got a patient who's using the label of letrozole plus palbociclib, you have to not only convince them to take their letrozole, which I know all of our patients love taking, but you have to know that they're only going to take 21 days of the palbociclib, which thankfully, with it being a specialty medication, it's expensive and their insurance company is going to make sure they only get 21 at a time. So they're helping us in that way. But it doesn't change the way that you need to manage your patient's medications. So some of these require the same consideration as IV meds. I mean, it's working in the same, not in the same way, but it does have side effects. Adverse effects should always be assessed quickly, right? We've got breast cancer patients and they're metastatic. This is not their first rodeo. So they're going to want you to get back to them quickly and they're going to expect that. And with these being a relatively new class of agent, you can't just discount side effects that previously you'd be like, well, you're tired. Okay, well, duh, you're going to be tired. With the monitoring of the possible neutropenia and all of the other things that come along with this class of medication, you need to encourage your patients to get in contact with you, either through your patient portal, where they can send you the message directly, by phone, which is sometimes a double-edged sword. Sometimes they can get a hold of you right away. Sometimes they leave you a voicemail saying, "Hi Austin, I'm bleeding out of my ears, just wanted you to know." And then some of our more elderly patients, I have some patients who don't have a phone and don't have a computer, so I send them a letter saying, just a reminder, you know, your palbociclib, your Ibrance needs to be refilled in a week. And thankfully our specialty pharmacy is pretty good about that. But those are all things to consider for any oral medication, but these in particular. Caregiver considerations, so the invisible patient. Husbands are not as good as wives as caregivers, I can say as a husband. You know, a lot of times they're not as on top of it as some of your female caregivers will be, so it's important to engage them and make sure that they feel like they're part of the process as well and that they can call you too if their significant other is not doing well. So they're also going to be your number one helper when it comes to compliance. So I tell people if they're a little forgetful that they need to go and pick up their old lady pill box and they need to fill it up for the whole month and make sure that they have everything laid out so that if they're living by themselves, their caregiver can come over and look and say, Mom, you missed X, Y, and Z days. Let's talk about ways that we can work with that. If they're homebound, maybe home health is a good idea for medication management if this is the first time they've been on something like this. Another thing to do is put the meds right next to your bedside table and take it right when you wake up. If you have small children or dogs that like to get into things, that's really a bad idea. But another service that you can use are the many services that our pharmacies will offer. So Mediset delivery that are pre-filled, pill packaging services, you know, where they come in the box and it has everything on it and they can just pull it out and it says what day, what time, and what's in the package. That's very helpful for some people. Other people aren't going to go and pull it out at all. So you just have to know that each of your patients is different. Imagine that. I think I went one too far. Specific considerations for this drug class. Neutropenia, just like you saw in all the trials. Neutropenia is the number one side effect. And this isn't a side effect that a patient can feel. They can feel alopecia. They can feel nausea. They can feel vomiting and diarrhea. So CBC monitoring is going to be important. So again, just like the compliance with the medication, compliance with the follow-up testing is important too. So according to the package insert, they want you to check at day 14 for the first 2 cycles. Some patients just are not going to come on day 14. But please be sure that you get that CBC on day 1 of cycle 2 and day 1 of cycle 3, because if you don't, you could be not you, but as a nurse, we're gonna get blamed. You could be doing more harm to your patient by not making sure that they're complying with that. So I always reinforce the importance of the day 14 CBC, because if they've dropped quite a bit by day 14, we need to know that so we can kind of be preparing for their next day 1 that they're gonna come and see us. Phone reminders, scheduling appointments, even if they don't have a port or central line where they would technically need one. Sometimes I'll make an appointment for someone who doesn't technically need one so that they then feel somewhat more obligated to come. And there are other people that you just got to call and call and call. But it shows that you actually are paying attention to your patients and do care. So.
I have experienced few. When my first blood count before I started the drug, I think because of past chemotherapies, my white counts and blood work with like the hemoglobins, they tended to be on the low side anyway, and so we kind of fluctuate back and forth at the bottom edge of low to maybe a little bit below. The week that I have off, usually they go up, and it hasn't been low enough where I have had to take a break or change the dosage.
So febrile neutropenia, if you're in the solid tumor world, you may not see a lot of this, but any patient who is either on this agent or any kind of chemotherapy, this isn't chemotherapy, remember, but any patient in general that is having a fever on treatment, they need to call you right away. If they don't get a hold of you, they need to come in right away. And if they can't come in, they need to call 911, because this is something that can lead to a patient death that should not lead to a patient's death. So I go over with patients that if you don't own a thermometer, today's the day to go buy one. Because it's something that you are going to need to be on top of, and this is the trade-off for not having some of the other side effects. You have to watch this a little more closely. Patients that have had your heavy hitters, so the platinums, the docetaxel, these types of agents, they're well aware of the importance of checking their temperature and watching out for neutropenia. But if you're putting someone on this as first line and they're diagnosed as a metastatic breast cancer patient, they may discount some of the teaching that you do because it's just a pill. I mean, why so serious? So that's one to hit home on. Other adverse events that are very common: leukopenia. Well, if you got neutropenia, you got leukopenia. Infections. Honestly, in my practice, I have not seen a lot of infections, but that doesn't mean that it won't happen. Nausea, I do see that sometimes, but it's easily managed. This isn't something that you have to use Amend and Dex and everything else with to manage. Usually it's managed pretty well with, one oral antiemetic versus a whole slew of them. Anemia, stomatitis. I've only had one patient that had stomatitis, but to that one patient, it's a huge deal. Headache, diarrhea, thrombocytopenia, constipation, blah, blah, blah. But the number one that are important to quality of life, fatigue. So America in general does not exercise. Exercise is hard work. Exercise requires you getting off the couch from an awesome episode of Dexter or whatever you're watching. And I have cancer, by God. I don't have time for that. So I explain to people that exercise is free medication that you can use to stimulate your energy. And they say, well, I don't really want to go to the gym. And I say, I'm not talking about you going to the gym. Like on the slide, it says walking or biking. not American Ninja Warrior, you know? So get up and move. And even if it's 10 minutes at a time, do 10 minutes twice a day. Oh, well, I guess I can do that. And it's amazing that energy boost that people will get from doing that. So that's something that you can recommend as a nurse. You don't need a script, and your patients will benefit from that. Nausea, like we talked about, easily managed. And here's what a patient had to say about side effects.
The side effects that I experienced was a slight thinning of my hair, which wasn't significant. Fatigue, which wasn't really life invasive or anything. I could still function and do most of my work. It just took me like a little longer. And then a little loss of appetite, but I quickly regained that.